people for COVID-19 too early in the course of infection is likely to result in a false negative test. Dr. Reena Mehta joins us now with what that means for people who've been exposed to someone with COVID-19 or believe that they have the virus. Good morning, Dr. Mehta. Can you hear me?
Meg, good morning.
There we go. You're frozen there for a second, but I think you're back. Good. So first, can you talk about the different types of tests that are available these days to help diagnose COVID-19?
Absolutely. So we have our molecular PCR test. That's our RT-PCR. That's the one that we use most commonly and is considered the most accurate. So that's the one when you go into the clinic or the urgent care and you get the nasal swab and you get your results a few days later. So that's the #1 test and the most commonly used test. After that becomes the antigen test, which is your rapid test. So the rapid test is you go in and you get your results within, let's say, an hour. Now, while this can be more convenient, it's considered to be less accurate than our RT-PCR test. So those are the two that we have to diagnose active infection.
Gotcha.
And then when we're thinking about, have I been exposed to the virus? Then they're thinking about things like the antibody test. So that would be the one, have I been exposed to the virus before? Now, obviously the antibody test, as we've all heard, has its limitations because it doesn't necessarily say, am I immune to the virus? It just means, have I been exposed at some point? And that's usually a few weeks after active diagnosis.
You know, when most people think that they've been exposed to someone, or even if they start feeling sick, you want to rush out right away to your doctor's office or the urgent care to get tested. But tell us about this new study from Johns Hopkins University that says maybe don't go right away.
Exactly. So this was a study published in the Annals of Internal Medicine. And what they did was they looked at multiple different studies, which equaled over 1,300 different nasal swabs. And it was looking at that molecular RT-PCR test, the one that we know most commonly. And what they found was that if you are at day 1 of exposure, which means you're not infected, you're just exposed, there was a 100% false negative rate. However, if you are at day 5 of exposure, which typically is the first day of symptoms, there is about a 38% false negative rate. So again, there's still limitations. If you are at day 8 of exposure, which is your 3rd day of symptoms, that false negative rate drops to about 20%. So basically what this is saying is that there is still limitations in the test. The false negative rate is still there. However, if you test further into the course of the illness, specifically at day 3 of your symptoms, you're likely to get the least amount of false negatives. Now, I understand this isn't appropriate for everyone because you might want to know right away, you know, do I have COVID or do I not have COVID? And so while it might not be ideal to get tested on day 3 of symptoms, if you have all of the symptoms of the virus and you have a high risk exposure, you might just assume that you actually do have the virus even if you test negative.
And quarantine yourself out of an abundance of caution.
Exactly.
So here's the question. What if you're exposed to someone, you know you're exposed to someone who's got COVID-19, but then you never experience any symptoms? Should you still wait to go get tested?
That's a really great question because recently the CDC has updated their guidelines on testing, and they're saying that if you don't have symptoms, you don't necessarily need to get tested. Now, I know that, you know, that doesn't probably settle well with a lot of people, and even myself, I feel like, well, if I have had a high risk exposure, I think if it's a family member or somebody that you are, you know, really exposed to for a good amount of time, it is reasonable to get tested, but you can also wait to see if you develop symptoms and quarantine during that time period.
Gotcha. All right. Well, Dr. Reena Mehta, thank you very much for this information this morning.